Hi, this is Miss Bacon, and here's part two of the Chapter 16 lecture all about medical insurance. So we were starting to talk about Medicare. We talked about Part A and B, how that was part of traditional Medicare when it was first created in the 60s. So Part A is hospital coverage, Part B is provider coverage for a patient. And we realized as a country that that was not enough coverage as medicine became more sophisticated and expensive with the times. So in the 70s and 80s, we had the creation of Medicare Advantage plans, which are basically, HMOs or PPOs that a Medicare patient could enroll in. So every November, a patient could pick a plan and they would roll over their Medicare Part A and B and C into a Medicare Advantage plan, whether it be an HMO or PPO. And these plans are administered through all of the different private health insurance companies that exist out there, like Blue Cross, Blue Shield, United Healthcare, Cigna, Aetna, UMR, all those different plans have Medicare Advantage plans that patients can enroll in. So these plans too also have Part D prescription drug coverage because a lot of seniors have to take prescriptions. So it's a great way to help seniors get comprehensive medical plans to take care of their healthcare needs. And when someone comes to you as a new patient, sometimes they'll give you their Medicare Advantage plan plus their Medicare card. You would never bill both of them. You only bill the Medicare Advantage plan because their Medicare card is like rolled over into it. So when that happens, you can explain that to them and you just bill their Medicare Advantage plan. So that's one way you can structure your Medicare benefit. Sometimes too, patients, they don't want a Medicare Advantage plan. They just want to stick with their Medicare, traditional Medicare. So sometimes patients just have that and they just have Part A and B. Other times, patients enroll in a Medigap plan. So they have Medicare as their primary, and then they'll have a Medigap plan as their secondary, but it's really a supplemental. And so the coordination of benefits would be Medicare first, the Medigap second. So those are the three different ways that a Medicare patient can structure their Medicare, just to let you know. So that's a little bit about Medicare. So here's what the Medicare the Medicare card looks like. It's red, white, and blue. And here's a Medigap card. The Plan F, it's the most popular plan I see. It's the best plan. And just know your Medigap plans, it's always going to be a Medigap plan if the plan is a letter. So Medigap has plans A through Z. So if it's Plan B, Plan F, Plan J, it's a Medigap plan. So the way that you coordinate the benefits, you bill Medicare first, and then the secondary would be the Medigap. So that was all about Medicare. Now we're going to be talking about Medicaid. So Medicaid helps out low-income patients who do not have health insurance and can't afford it. So it's really important that we have sort of the safety net for these population of people. And in every state, Medicaid has its own unique name. So in California, Medicaid is called Medi-Cal, whereas in like Tennessee, I think they call it TennCare or something like that. So every state has a unique Medicaid name. And just know, patients too, they can have Medicare as well as Medi-Cal. So they would be a Medi-Medi patient. And just know, if a patient has Medi-Cal and some other insurance, Medi-Cal is always the payer of last resort. You always bill Medi-Cal last. So just remember that about Medi-Cal. You always bill Medi-Cal last. They're the payer of last resort. Let's see. And Medi-Cal is there to provide coverage to low-income patients. Now, here are some pictures of current Medi-Cal cards in the state of California. So this one right here is the most current with the California flower, the poppy on it. That's what the new cards look like. These are kind of like the old Medi-Cal cards. And you'll see too, there's Medi-Cal managed care plans. In Southern California, Cal Optima is really popular, which is sort of a managed care plan kind of under the umbrella of Medi-Cal. So that was it about Medi-Cal, what the cards look like. So now we're going to switch gears and look at the military. So definitely we provide healthcare benefits to our military personnel who serve our country. And if we have active duty military personnel, they get coverage through TRICARE, as well as their spouse and dependents. So the entire family unit gets covered under TRICARE. And TRICARE Prime is usually what the active duty they get enrolled into. It's an HMO. And there's also, so the Prime is the HMO, the extra is the PPO, the standard is like a fee for service, but everyone automatically gets the TRICARE Prime, gets enrolled into the HMO. I'm sure if they wanted to pay more, they could get into the PPO plan or the standard. And the TRICARE card, hopefully it's on the next slide. But before we move on to that, if you work at a military treatment facility, you determine eligibility by using the DEAR system. That's how you can determine eligibility for TRICARE recipients. So here's what the TRICARE cards look like. So when I have military personnel come into the clinic, it's always this kind of card that I see. And the trick with TRICARE that's super important is there's like a number on the front here. You don't enter that number to your computer. Their DoD benefits number on the back of the card, that's what you enter into your computer. That's what you want put on your claim when you bill TRICARE. So it's super important not to get that mixed up. It's always the number on the back of the card. That's what you input as their ID number in their insurance and their chart. So it's a little bit about TRICARE. And just note too, when you are checking in a new patient, you're going to copy their insurance card, copy their driver's license, input their insurance correctly, their name on their chart match the name on their insurance card. Look on the back of the insurance card, the claims mailing address, that's what you want in your computer. Make sure that you enter in the ID number, the group number correctly, the effective date of the policy correctly, as well as their deductible, copay. You want to indicate, the policy, what is the relationship of the patient to the subscriber? Is it itself. Is the patient the subscriber, or is the patient the spouse of the subscriber? Is the patient a dependent of the subscriber? You want to indicate that relationship too in their chart. I also have to input their employer's name in the insurance area. So those are the major things I have to input correctly. And then once I've created their insurance in their chart, I run eligibility, and my computer will tell me that it's eligible and there are no edits, right? Or it'll say rejected, or it'll say ineligible. So if it's rejecting or ineligible, there's a big, huge problem, right? They can't be seen, or we need to have a conversation that, they can be seen, but they might get a bill for that date of service. You just want to be really honest and transparent with them, because, it's their money, it's their bill that they might be getting. And if you can, there might be edits in the insurance when you run it that you can fix to make it eligible with no edits. So you just have to kind of work with it to try to resolve any problems that there are. And again, if problems arise, just communicate with the patient so that they are fully aware that today's visit might not be covered by the insurance. So that's my little advice when it comes to running that eligibility when you're checking in your patient. So moving on, when it comes to CHAMP VA, so this is the big, huge distinction here. CHAMP VA is for your disabled veterans, right? So they were in the military, they served our country, and they got some disability through their service. And it's a permanent total disability. So they are going to be covered, as well as their spouse and children. So that's CHAMP VA. That's how it's different than TRICARE. Here's what their cards look like. And the CHAMP VA patients, they go to the VA to get their services. So I don't really see VA patients. And I think most of them go to the VA in Long Beach. I think that's the closest one to us for the veterans. And last but not least, we also have workers' comp insurance. So by law, every employer has to provide insurance to employees to cover them if they get hurt on the job. So if we ever get hurt on the job, notify your supervisor. And if you need to, go see a doctor for your injury, and you'll get taken care of through workers' comp. So that's a little bit about workers' comp insurance. And just make sure, that you follow your company's policy, because they usually have some more specific that you have to go to for your medical care. And here's just some screening for insurance that I've talked to you about earlier. And just make sure you run, like screening for insurance, you're just running eligibility, making sure that their insurance is active, it's eligible, it's in network. And you got to do this for new patients, and also do it for all your established patients at least once a month. And then that way you know that they're not going to have any billing problems if their insurance comes back eligible. Let's see here. I think I'm running out of, oh my goodness, I'm running out of time. Okay, so referrals and authorizations, just know you're going to have a referral department that kind of handles this to get the referrals authorized, okay? And this is the claim form that we use to bill insurance companies for reimbursement. This is what it looks like. I'm going to gloss over that. There's lots of careers in insurance, right? You can be billers and coders. So definitely check into that. It's really